Welcome to Podocyte Talk. In this episode, we highlight 3 recent studies that provide important insights into cardiovascular protection during dialysis, the interplay between kidney function and volume status in heart failure, and the impact of infections on survival following kidney transplantation. The first study is a randomized crossover trial evaluating the cardioprotective effects of aerobic intradialytic exercise in patients undergoing hemodialysis. Regional wall motion abnormalities, commonly observed during dialysis, are thought to reflect transient myocardial ischemia, especially in the apical segments of the left ventricle. This study aimed to assess the regional distribution of these abnormalities and determine whether intradialytic exercise modifies their extent or location. 72 patients underwent 2 dialysis sessions, one with standard care and the other incorporating 30 minutes of aerobic exercise. Segmental myocardial strain was measured before dialysis and at peak stress. The number of abnormal myocardial segments was significantly lower during the exercise session. Moreover, while standard dialysis was associated with a higher prevalence of apical abnormalities, this regional gradient was not present when exercise was performed, suggesting greater apical protection. To explore mechanistic insights, isolated cardiomyocytes were exposed to ultrafiltrates collected from patients during both sessions. Cardiomyocytes treated with ultrafiltrates from the exercise session exhibited improved contractility and calcium handling, and reduced cellular stress responses. These findings support a role for humoral mediators released during exercise in modulating myocardial injury during dialysis. The second study is a post-hoc analysis from a large randomized trial investigating the relationship between changes in kidney function and congestion status and their association with mortality in patients discharged after hospitalization for heart failure. While decongestion is a key therapeutic target, it often leads to declines in kidney function, raising concerns about potential harm. In this analysis, patients were categorized based on post-discharge changes in clinical congestion and kidney function. The results demonstrated that improvement in congestion was consistently associated with lower mortality, even when accompanied by mild to moderate reductions in kidney function. However, in cases where kidney function declined markedly, the survival benefit of decongestion was diminished. These findings suggest that modest declines in kidney function may be an acceptable trade-off for achieving euvolemia, but caution is warranted when kidney function deteriorates beyond a certain threshold. The study emphasizes the need to balance volume management with renal preservation, guided by individualized risk assessment. The third study is a retrospective observational analysis examining infection patterns and outcomes among kidney transplant recipients from a single center in India. Infections remain a leading cause of morbidity and mortality post-transplant, and data from low- and middle-income countries remain limited. The study included patients who underwent kidney transplantation over a 7-year period. Among 118 recipients, 255 episodes of infection were documented. Bacterial infections were most prevalent, particularly urinary tract infections, followed by viral infections, of which COVID-19 was the most common. Fungal, mycobacterial, and parasitic infections were less frequent. Both BK virus and COVID-19 infections were associated with increased risk of graft loss, and COVID-19 accounted for the majority of infection-related deaths. Despite the high infectious burden and the impact of the COVID-19 pandemic, the reported 1, 3, and 5-year patient and graft survival rates were comparable to those reported in high-income countries. This suggests that appropriate infection monitoring and management can mitigate the adverse effects of infections, even in settings with resource constraints. Together, these 3 studies underscore the importance of personalized evidence-based approaches in nephrology. Whether through structured exercise to reduce dialysis-induced myocardial injury, nuanced interpretation of kidney function changes in heart failure management, or proactive infection control in transplant care, each study contributes to optimizing patient outcomes in high-risk renal populations. Thank you for joining us on Podocyte Talk. References to all studies discussed in this episode are available in the description. Stay tuned for further discussions on innovations in kidney disease research and clinical practice.